Welcome inspiring the logic, I'm Nabid. The World Health Organization says the number of new COVID-19 cases reported worldwide fell 16% last week to 2.7 million. The number of new reported deaths also fell 10% week over week to 81,000, the WHO said in its weekly epidemiological update. The percentage of decline was double-digit in new cases, with only the Eastern Mediterranean showing an increase of as much as 7%. Report of 5 WHO regions in the world, Thursday, 18 halves. The number of new cases fell 20% last week in Africa and the Western Pacific, 18% in Europe, 16% in America, and 13% in Southeast Asia. WHO Director General Tedros Adhanom Ghebreyesus said on Monday that the number of new cases had decreased for the 5th week in a row, down by nearly half, from more than 5 million cases in the week of January 4. This shows that simple public health measures are working, even with new variants. What matters now is how we respond to this trend. The flames are not yet extinguished, but we have reduced their size. If we stop extinguishing them on any front, the fires will return. Roaring, said Tedros Adhanom Ghebreyesus.
Thank you, Fadila. Good morning, good afternoon, and good evening. Just over a year ago, WHO launched its first strategic preparedness and response plan for the COVID-19 pandemic. The SPRP outlined the comprehensive response needed and which many countries have followed successfully to suppress transmission, protect the vulnerable, and save lives. With an ask of $1.7 billion, the first SPRP saw an unprecedented response. With the support of member states and donors, we raised $1.58 billion, over 90% of which was allocated to countries and regions getting vital funding to those at the front line of the pandemic and supporting WHO's core scientific and technical work. It also enabled WHO and our partners to ship millions of tests and items of personal protective equipment and to support thousands of ICU beds around the world. We deployed 191 emergency medical teams, supported sero-epidemiological studies in 58 countries, offered 150 online training events reaching 4.7 million participants, and much more. Today, we're proud to launch the Strategic Preparedness and Response Plan for 2021. The new plan builds on last year's SPRP with 6 objectives: suppress transmission, reduce exposure, counter misinformation and disinformation, protect the vulnerable, reduce death and illness, and accelerate equitable access to new tools, including vaccines, diagnostics, and therapeutics. The financial need to meet these objectives is $1.96 billion, including $1.2 billion for the WHO component of the ACT Accelerator. And $643 million will go toward supporting people in need of humanitarian assistance in fragile, conflict, and vulnerable settings. The SPRP also recognized the need to fully integrate the COVID-19 response into planning for health and development programs. Fully funding the SPRP is not just an investment in responding to COVID-19. It is an investment in the global recovery and in building the architecture to prepare for, prevent, and mitigate future health emergencies. At the beginning of the year, I issued a call to action to ensure that vaccination of health workers was underway in all countries within the first 100 days of the year. Tomorrow marks the halfway point, and we have made progress, but we're not there yet. With the emergency use listing of 2 versions of the AstraZeneca vaccine this week, COVAX is ready to roll out vaccines and is waiting for several manufacturers to make good on their commitments. The world is moving closer to delivering the promise of vaccine equity. Vaccine equity will be on the agenda at both the G7 leaders meeting and the Munich Security Conference tomorrow. Tomorrow, WHO will also launch a new declaration focused on vaccine equity, and I have been encouraged by the support we have received from hundreds of organizations and thousands of people. Health worker groups, international agencies, religious groups, youth movements, sporting bodies and athletes have all signed the declaration. The declaration calls for action from several groups. It calls for political leaders to increase contributions to the COVAX facility and to share doses with COVAX in parallel with their own national vaccine rollout. It calls for vaccine manufacturers to share know-how with the COVID-19 technology access pool to scale up vaccine manufacturing and dramatically increase the global supply of vaccines. It calls for regulatory bodies to accelerate approval processes in a safe and effective way. It calls for ministries of health to work with WHO and others to invest in and prepare their primary healthcare systems for distribution of COVID-19 vaccines to health workers and to develop data systems on vaccine supply, distribution, and uptake. And it calls for all governments to ensure that COVID-19 vaccines are distributed free at the point of care, without risk of financial hardship, starting with health workers. Vaccine equity is especially important for fragile and vulnerable groups, and for small island states like those in the Pacific and Caribbean, with small populations who can miss out on vaccines because they have less bargaining power than bigger countries. Everywhere means everywhere. Nowhere should be left behind. Today, we are privileged to be joined by the Honorable Dr. Kit Rowley, the Prime Minister of the Republic of Trinidad and Tobago. Prime Minister, thank you for your leadership and thank you for joining us today. You have the floor.